Greetings, my fellow YouTube nurses, my fellow YouTube LVNs, my fellow YouTube CNAs, my fellow YouTube nurse practitioners. If you want to keep going to the ladder, we can keep saying fellow YouTube doctors, but let's just talk about what's going on in the medical field, the most important underrated CNAs. We love you guys. We could not do this without you. I'm going to bow to you guys because you guys are our eyes. Just as the RNs, LVNs are the eyes for the doctor, you are our eyes. Now, when we're documenting, when we're charting, when we're going through the progress notes, the doctor's notes, when change of a condition, anything that we're so busy on the computer and we have to get up, don't get us wrong. We do our assessments when we get there and we got to follow the orders and hang the IVs and pass the meds and talk to the family members. Yeah, I understand that. But now dealing with the blood, dealing with the feces, dealing with the urine, that's a lot of hard stuff. So let's talk about the CNA stuff that you guys get down. Changing the beds, properly transferring the patients, feeding them, changing them, bed baths, sticking by their side the whole time, and also changing the catheter bags and just doing everything as a CNA. That's a lot of busy work. Now I give you guys props because that's just a lot of hard dedication, and we couldn't do this without you guys, honestly. And I gotta respect my CNAs, love my CNAs. They give me the best feedback and I help them right back. So now on that note, I'm gonna get a moment of silence. Yeah. Alright, so anyway, let's talk about the certified nursing assistant and why it's important to start out in that field, because you're going to get your foot in the door. You're going to actually get ready for what is going to be for you in the medical field. If you want to become a nurse, LVN, RN, maybe nurse practitioner, it's always the best way to understand and know how it works. I would honestly recommend that. In my last video I talked about like what to expect first semester. You're going to learn a lot about that, so I figured I'll talk about it in this video. And the logistics about being a CNA is the RN will basically tell you what's going on with the patient, what you need to do. So for an example, if I had a patient who had, let's just say, breast cancer, had a mastectomy, right side, you're obviously not going to take the blood pressure on the right because that's where they had the mastectomy. So you're going to take it on the left, and you got to know for a heads up with the patient, let's just say they have dysphagia or they're on a feeding tube. You got to tell the CNA, okay, let's make sure the head of bed is going to stay up, elevated to decrease the chances of aspiration so they don't choke, whatever leads to pneumonia, blah blah blah. So you educate them, and the also cool thing about it as a CNA, man, you get to ask all the nurses questions. You get to ask me, other nurses there, what's going on. You get to see the doctor. You also get to see some cool things the doctor do sometimes. I remember one time during a patient who had she had a tube in her lung, and she basically had like a pneumothorax. She was in bad condition. They put a tube in there. So to make a long story short, a CNA walked in and the doctor just pulled the tube out. She got to see what was going on, which was really cool. CNAs can come in and help, and they watch sometimes as we do a catheter change or administering or inserting the catheter. But of course, you give patient privacy, bed low, put the side rails up. But but you got to do all your checks and everything. But as a CNA, you got to see a lot of stuff. But I'm gonna say we cannot do this without you guys. And another cool thing about being a CNA is you just get ready for what's gonna be up ahead for you. So when you become an RN or LVN or maybe nurse practitioner or even a doctor, you're gonna learn and understand the whole holistic care. And I would honestly say CNA is the best way to go. So I just gotta say, my CNAs, you guys are the best. You can't do this without you. So I'm gonna end it on that note and become a CNA.